The Early Intervention Services Program is part of the Prevention and Early Intervention component of the Mental Health Services Act. The goal of this component is to help counties implement services that promote wellness, foster health, and prevent the suffering that can result from untreated mental illness. The PEI component requires collaboration with consumers and family members in the development of PEI projects and programs. The Early Intervention Services Program objective is to provide early detection and intervention for youth and young adults who are developing early signs of psychosis and mood disorders. The goal is to decrease the duration of untreated psychosis and mood disorders before they become debilitating. This goal is accomplished through the use of broad community-based outreach with rapid referral, comprehensive assessment to determine eligibility, and by utilizing a team-based coordinated specialty care model. The CSC model is a holistic approach that includes case management, recovery-oriented psychotherapy, relapse prevention, family education and therapy, educational support, vocational training and support, pharmacotherapy, and coordination with primary care doctors. The Early Intervention Services Program is still in its infancy. The program was recently awarded $2 million to increase program outreach, capacity, and fidelity over the next 4 years. The Early Intervention Services Program targets transitional age youth from unserved and underserved communities of Lake County, specifically foster youth, justice-involved youth, and communities of color. Currently, LCBHS works in collaboration with other community agencies such as Child Welfare Services, Lake County Probation, Adventist Health, and Community Peer Support Centers. Community outreach will be increasing to reach underserved populations by attending community events and collaborating with community leaders from underserved populations. Additionally, materials that provide education about the program will be promoted on local social media networks to raise awareness and decrease stigma. The Early Intervention Services Program reflects MHSA general standards as follows. 1. Community collaboration. A cornerstone of the program is collaboration with various community partners to address the needs of the clients in order to support integration into the community and target disadvantaged and underserved populations. 2. Cultural competence. The team participated in a UC Davis training on anti-racist practices for mental health providers and a training on working with Native American populations. The team also seek to hire team members from various cultures and backgrounds. 3 and 4. Client and family driven. The team utilizes a strength-based approach, CBT, DBT, MI, and solution-focused techniques, all of which have foundations in a client-centered, client-driven approach. The team facilitates client-family meetings that focus on the client's progress in treatment, where families and clients are empowered to state their needs and strengths are highlighted. The team also provides psychoeducation and psychotherapy to clients and their families. 5. Wellness, recovery, and resilience focused. The EIS model by nature encompasses wellness, recovery, and resilience. 6. Integrated services experiences. Providing a holistic approach that incorporates clients' family support network, education, vocational skills, psychiatry, and care with a general physician. The Early Intervention Services Program targets children and transitional age youth. The program served a total of 52 individuals in fiscal year 2021. Of the 52 served, 11 were children, 0 to 15 years of age, and 41 were transitional age youth, 16 to 25 years of age. The Early Intervention Services Program served a total of 52 individuals in fiscal year 2021. Of those 52 served, 2 identified as Native American, 3 identified as Black, 35 identified as white, 4 identified as having 2 or more races, 3 identified as Hispanic or Latino, 34 identified as not Hispanic, and 8 identified as Mexican American. The Early Intervention Services Program served a total of 52 individuals in fiscal year 2021. Of those 52 people served, 33 identified as being born female, 17 identified as being born male, 32 identified as female, and 21 identified as male. The Early Intervention Services Program served a total of 52 individuals in fiscal year 2021. Of those 52 people served, 13 reported having a disability, 29 reported no disabilities, 9 either refused or were unable to answer. Of the 13 individuals reporting disabilities, 1 had a vision disability, 1 was hearing impaired, and 9 had cognitive disabilities.